Thank you, Senator Alexander. We do not want you to miss the students out there. I came back because I wanted to ask a question about how we are dealing with the ability, the pretty easy ability of individuals to purchase online, gain drugs, illicit drugs, or unfortunately in Alaska, we're seeing the purchasing of drugs that have not been, they've not been rescheduled, and so they're effectively legal to purchase over the internet. And I was at the Healing Center in Bethel just a few months ago and talking with folks about where are people getting their drugs here in a community like Bethel, where the only way in and out is flying in. And no question about it. They were very open in where they got their drugs, actually naming some of the websites that are out there. It is just common knowledge. And unfortunately, this is a reality that we're dealing with. And I know that Dr. Gottlieb, there was a target through the FDA of these rogue websites that are illegally selling opioids, other prescription drugs out there. And this was an effort led by Interpol to, I understand, 13 letters are sent to operators of over 400 websites, seized almost 100 domain names linked to online illicit drug sales. I was looking at the article. It's not like these folks are hiding these websites. I mean, one of the names of the website is buyhydrocodineonline.com. There's no secret there. So the question that I have is whether or not that effort was successful, whether or not there's going to be an ongoing follow-up of this. I struggle with how I go back to people in these villages that are saying, hey, it's coming in the mail, it's coming in every day. How are you going to stop it? What's my response? What progress are we making?
Well, we're making progress, Senator, but not enough. These rogue operators, to your point, are hiding in plain sight. We'll have other operations. This was an operation we conducted recently with international partners, including Interpol, as you mentioned. We'll have other operations. We don't announce those in advance. But I mentioned that we increased the number of FTEs, requests I made when I came to the agency, the number of personnel we had in the international mail facilities from 8 to 22. We tripled our footprint. We've physically maxed out our space in the IMFs. That's why I couldn't put more people in there. And that's in part why we're talking to our good partners at CBP about getting more space so we can put more resources in. But you know, having gone to the IMFs and looked at the operations we have there and the hardworking people we have in these facilities, I could tell you that the people who are shipping drugs into this country aren't going through a lot of efforts to disguise their tracks, because they know that only a small percentage are getting seized, and as soon as they find out that we're seizing drugs coming in from one route, they'll just change the route of delivery, and they're simply overwhelming the system. So I think we need to be looking much harder at that. We also increased the number of personnel we have dedicated to our cyber crimes unit, looking at the dark web where a lot of these drugs are being ordered. But there, too, I think that there's a lot more that we want to be doing.
Well, and I'm certainly hopeful that within FDA it's kind of a multi-agency approach to how we're going to deal with this, working with Postal Service, working with DEA. But again, as you say, they're hiding in plain sight, and it doesn't take a genius to figure out how to access this and then bring these products into the communities. I want to ask one more question here, and that is about treatment. Senator Franken raised it, treatment facilities in our reservations in the lower 48. We've had some conversations about how in Alaska this 16-bed limit on Medicaid reimbursement, the IMDs, is a real limiting factor for us. But I also appreciate that as much as we need inpatient, when we have outpatient treatment, a lot of the population that we're dealing with are individuals that are homeless, They don't have the alternate or transitional housing that they have that they need. They're coming out of incarceration. So you've got the housing piece of it, but it kind of speaks to the kind of treatment then that goes on within the prison system itself. And it's my understanding that for the treatment for those that are incarcerated, they lose any pre-existing Medicaid benefits when they are due to be released, and when they come in, and then they have to reapply at the time of the release. So you've got a situation where at a time somebody might need the treatment most, they don't have that coverage. What are we doing as we're dealing with the need for treatment for those that are in this situation, which is really very much in flux, whether you're in prison or whether you're coming out of prison, those that are in an outpatient but really have no place? How big of an issue is the housing piece in terms of how we deal with treatment?
I think that the housing issue is a very significant one, and we know that a large number of homeless folks in our country have either or substance use disorders or serious mental illness. And so, and it's also true that people, once they're incarcerated, they do lose any Medicaid benefits that they might have had. And so what needs to happen is that when we know when people's sentences are going to flatten, when they're going to be released, and we have to be working with the justice system, with the Department of Corrections, months ahead of that to make sure.
But we're not doing that well, right?
We're not doing it well, but there are models for it, and my state of Rhode Island has a very nice model for that, that SAMHSA actually does work to disseminate to other states as well. And we also provide technical assistance around other promising types of interventions of that type that other states are starting to explore. It's an issue that that will require not only the resources that we can provide through the government, but also community resources. And so we have to be working with people in the community, recovery coaches, peers, and other faith-based groups and other types of supports within communities, families and significant others that will help people with these issues. The goal would be to bring all of them together so that happens before somebody comes out of incarceration.
Yeah, and unfortunately, I think that's where we've got a real big gap right now.
We do. You are right.
Yeah.